We hear a lot about diabetes, but do we really know a lot about this disease? Well, here to break it down for us from MyCare Medical are Dr. Pritesh Patel and Gigi Sanchez. Welcome to the show. How are the both of you?
Thank you for having us.
So it seems like if you don't have the diagnosis of being diabetic, or maybe someone in your family doesn't have to battle diabetes, you might know the name, but not necessarily know what it is. And I know we want to kind of clear up some misconceptions and most importantly, of course, how you can help. So let's first talk about diabetes. In general, overview, doctor, what do people face?
So basically diabetes, there's multiple types of diabetes, type 1 diabetes, type 2, and then there's gestational diabetes, which is in the pregnancy. Patients with type 1 diabetes, we have them with mostly younger patients that are insulin independent. Type 2 diabetes is the majority of the diabetes that we're talking about here in the adult onset, where age 40 and above, as well as in the geriatric population, where majority of patients, when they get older, they develop diabetes through different reasons, such as genetic reasons where the parents may have it, along with maybe poor diet and exercise. Obesity is a big problem in the United States where causing diabetes. So a lot of these medical conditions, including diabetes, can be prevented if we appropriately manage our diet and exercise. And through that, from our MyCare Medical, we have Gigi, who helps us out at the office settings where coordinate the care.
Sure. Our physicians are trained to do coordination with our care, because it's not only about the physician in our clinics, it's coordinating the specialists outside. Like the doctor mentioned before, Dr. Pritesh Patel, that we have to have a dietitian. We have to have someone that actually, other specialists that are involved to keep the health for our patients that are actually Medicare patients, older adults. And with our physicians are trained to do that coordination.
You know, it sounds like it's a real team effort, and I can tell the both of you are already just bouncing off each other, how important that is. And when people do get that diagnosis later in life, it seems like you kind of prepare as you age, like I know more things are going to go wrong, but finding the right resources, the right care, even possibly finding a cure, because there's not a cure for diabetes, right?
True, there's no cure for diabetes, but a lot of the diabetes we can control it, like you said, proper diet, exercise, good team effort at the primary care settings where your primary care doctor can lead the process of helping you manage the diabetes, sometimes without even medications. And if you're on medications, we can reduce those medications if we take the proper approach.
I'm curious, if someone does have it in their family and people are like, oh, this runs in my family, is it kind of a guarantee that they're going to see that, or is that not the case?
So it's not guaranteed, but more likely than not, the genetics does play a big role. We can avoid it, like I said, if we do the proper diet, exercise, proper testing ahead of time. So seeing your primary care doctor once a year to do the blood test, we can prevent that. There's pre-diabetes, we can pick it up ahead of time before it becomes diabetic. And we can manage the pre-diabetes in a sense that diet and exercise will prevent diabetes.
So again, talking about taking all of those steps prior and even after the diagnosis. Let's talk now locations and what people you can help out there. Because I know one of the things you're proud of, bilingual staff, right,
That's
Gigi?
correct. In MyCare Medical, we are in Pasco County and Hillsborough County. We not only have our physicians are bilingual, but the staff is bilingual as well. So it makes them a little bit more comfortable to come in. They're treated like family. It's really important to choose a primary care physician that actually care for every single aspect of your health. So give us a try, give us a call, and we were more than happy to give you a extremely good VIP tour so you can meet our staff and you meet our doctors and you make the right choice for your life.
Well, I think we need to share locations too so people can get more information, see how you can possibly help them. Give us an idea of where you're located.
Sure. We have 22 providers in 13 different locations. You can go on the website, MyCare Medical Group, and you can see all the locations that we have. Like I mentioned before, we are in Hillsborough and Pasco County here in the Great Tampa Bay area.
Dr. Patel, Gigi, great to see the both of you. Thank you for talking about this.
No, thank you so much,
today.
Thank you very much.